Good afternoon, everyone. Welcome to another episode of Spilling Tea. I'm your host, Tiffany Daniels. We're going to be getting back to our little mini-series in regards to Medicaid and why the cuts or any potential type of freeze, why exactly that can be absolutely devastating. I do, before we get started and I go through the trigger warnings, want to mention something here. Before we get started, I have heard every single MAGA talking point in regards to this subject. I also know of the gaslighting of our current Trump's public relations Barbie. Okay? You know the ones where it said it's not going to affect those who really need the services. Okay, first of all, those who really need the services should be a way of sentence framing that should scare the hell out of you. Because that means not doctors that act, as advisors in regards to things such as Medicaid cuts are not going to be the ones who are going to be mainly informing policy on this. It's going to be a bunch of these MAGA politicians. Why is that a bad thing, Tiff? Not a single one of them know a single goddamn thing in regards to the service system, how it's funded, and what exactly that it covers. They do not have the first idea on planet Earth how much, just so much, is a tiny little freeze. Yes, even the ones like Trump's doing with the tariffs right now. But then they'll do it and walk it back. There's a problem with that. The problem is that funding is covering a whole lot of very vital medical services for a lot of vulnerable disabled people. Freezes in funding in things in regards to like oxygen tanks, wheelchairs, assistive transportation equipment, getting to and from medical appointments. Stop thinking about yourself and think about those of us that are more in need of those very fundamental services here. Let me reference back to my friends over in the Sassafras apartments. Many of them are what used to be called or termed medically fragile. They have to be very careful with their immune system, and there is usually a special level of stress for them, especially when traveling during flu season, which you guys got a little bit more of a better idea about during COVID, but would prefer to scream at them as opposed to listen to their points and just how exactly you're putting them at risk with your behaviors. We'll not get into that. We'll get into the ableist nonsense another day. But what I'm trying to say here is Medicaid is just not like this some little insurance out there that, maybe it covers me to go get veneers. No, that's not how Medicaid works. First off, if you do have Medicaid and you have a dentist that is willing to do the dental work and not put you in the red, please let me know in the comments. I need their phone number. Okay? Even when they say they cover things, finding someone in your area that actually provides the service and accepts Medicaid, you might as well be searching for the Ark of the Covenant or the 13th tribe of Israel. Jimmy Hoffa and Owen Trump. Okay? What we're talking about here, the freezes and potential cuts, regardless of what the MAGA folks are trying to tell you, it's going to put those people at risk. Okay? You can't just take a scalpel to Medicaid. Now, for those, but only the people who really need it, and who gets to decide who really needs it? That should be the question you ask yourselves when you continue with what they're trying to tell you and allow them to lull you into a false sense of security here. Who gets to decide who really needs that Medicaid funding and who doesn't? Because as of right now, it is already extremely difficult to be able to qualify for Medicaid. Okay? Even when I've had so much as a part-time job, I was considered making too much, and my Medicaid got cut, and I did not have medical insurance again between the years of 2008 to 2020. Okay? It's extremely difficult to get, and in a lot of ways, extremely difficult to keep. They have already narrowed down the criteria in regards to who they will accept to be able to receive Medicaid and get access to that funding and who doesn't. You may not believe it, but it is already extremely tight. And there's a lot of individuals who could really use some of the services like that ARC provides that do not have access to it because of the tightening that took place back in the 2010s. You have a lot of people falling through a whole lot of cracks. Alright? Just with the current system as it is. Okay? Are we good? Good. Because I'm tired of this idea that some MAGAs seem to have that But you get Medicaid and it's a privilege. Really? You try living with it. You go on Medicaid for a month, and allow yourself to be limited in regards to your health care funding, what they will and will not do for a singular month. And then you can come back and talk to me about how privileged people with disabilities are with access to that Medicaid funding. Okay? I'm tired. All of us are tired. There is a reason why instead of cutting Medicaid, there has been a lobby to expand it so that people with disabilities could be able to get more, better medical and other services received through the service system. Okay? I'm sorry, but I'm not sorry. If you have an individual standing up at the podium speaking for the president and the words out of their mouths in regards to possibly cutting Medicaid but it's going to be perfectly safe for those elderly and disabled people who actually need it, if these words comfort you, I'm going to need you to stop smoking crack. Okay? These people, I've told you guys on this channel multiple times, they do not care about us. They don't. And whatever words of reassurance that you ever hear come out of anybody's mouth in regards to Medicaid, such as, but we won't be taking it away from those people who need it the most, the first question out of your mouth should be, and who do you think those people are, Karen? Is there not already a very strenuous screening that most of us go through who have been on Medicaid before in order to retain those services, and that there are thousands, millions of people who are disqualified from receiving those services every single day, because as a person who has worked for my state, I can promise you there are. Alright? I just wanted to get that off my chest because people, you gotta stop trusting the damn politicians. I don't know how many times I have to say it. Okay? I really don't. I don't trust any of them. The reason is I've been doing this a long time. I've seen both sides let us down and rip us off and lie bold-faced right to our faces over and over and over again. Okay? When they tell you things like that, you should be more scared, not less. Politicians should not be able to tell you who they considered disabled enough to be able to receive Medicaid and who isn't. Okay? That is my point. There is already a screening process. It is already extremely difficult in order to get accepted into these programs. It has been narrowed down in regards to the acceptance criteria multiple times. In fact, it is far more narrow than ever it was back when I was 19 and was on it that short while going into transition services between high school and college. Okay? Please keep that in mind. And let me kind of continue this here. I know I kind of went off and a little bit in left field. Just guys, please trust me. When it comes to Medicaid, when it comes to Social Security, you can't trust any of them. You got to keep your eyes peeled and keep your eyes on the ball. Believe your own eyes, not what politicians tell you you should believe. Okay? That's all I'm saying. But yeah, any potential freeze, when I told you yesterday it is life and death, I am not exaggerating. I am not overemphasizing the point or blowing it out of proportion. That is literal fact. Oxygen tank runs out for an individual who is running a little low, and Trump decides to do a bit of a flip-flop. So he freezes Medicaid for a second. A second is all it takes, folks. Okay? That's all it takes. Any freeze is a freeze across the board. I have not seen anything that has been brought to the front by any Republican right now that shows me that it is going to be a very strategic and selective freeze. It's just a freeze. Freeze hits everyone, including those who cannot afford to have so much as a single minute freeze. Those who rely on that funding for life-saving equipment, oxygen tanks, and other assistive gear for the most vulnerable. Those who are paraplegics, those who are paralyzed, yeah. People with severe autoimmune disorders, with their filtration systems. It's a pretty long list. Alright, now we're going to get back to this. We're going to why it matters. Now, you're going to find the link to this, just like the other day, right there in the description box if you'd like to pull it up and read it for yourself. So, Medicaid makes life in the community possible is the primary source of health care and community-based supports for many people with intellectual disability or developmental disability, as well as the physical. The federal state Medicaid program is the major and usually the only, capitalized only, in the majority of the states, that catch-22. If you do not get Medicaid, you do not get services. Tattoo it on yourself somewhere. If you do not get into Medicaid, you do not get access to those services. I may still work with ARC, but because I'm on independent insurance now, the services that I have are all done through Burrow. Now, thankfully, I am past the transition age where I don't necessarily need a community integrator or quite nearly as much oversight as I did at the beginning of coming out of high school. I pretty much maintain everything all myself. I have my team that I check up with periodically to talk if there needs to be any discussions in regards to medications, anything that's been bothering me that I need to work on. You get the picture. I'm older, services have changed. I don't need nearly all the supports that I used to. So that's fine. But for people like me who still need all those supports, like we've talked about on this channel, direct care staff, community integration, occupational therapy, speech therapy, you name it. If they don't qualify for Medicaid, they don't get services. Like, I don't know. Write it with a Sharpie somewhere inside your head, tattoo it, I don't know. But that's the way it is. Okay? Source of funding for long-term supports and services that many people with intellectual, developmental disabilities, or physical disabilities, I'm including that. I know which ones the ARC cover the bulk of, rely on to live in the community. This effective and cost-efficient program allows people with intellectual or developmental disability to live and work among their neighbors. Remember, we're talking job coaches, partnerships with vocational rehabilitation, and assisting us to get jobs out in our community, creating circle supports within the community itself so that you can be interacting with the community. Everybody's there to kind of all help each other. And there are emergency go-tos for us if there's a situation that pops up and we're out in public and can't, teleport home. More's the pity. You get where I'm going with that there. While Medicaid is federally administered program, states retain authority and flexibility in providing services. Medicaid funds both mandatory services, we will be going over that, which states are required to provide under federal law, and optional services. However, states like mine that never really got out of the 2008 recession, to be absolutely honest with you all. We rely very heavily on that federal funding to boost up all these state services, to cover the wages of our case managers, our social workers, those who are, like myself, the advocacy specialists that specialize in particular in being the voice for the consumer in regards whether it comes to their health care or their housing, getting them involved in extracurriculars, teaching them how to advocate with themselves, both out in the community in regards to transportation, in regards to health care, You see where I'm going there? It covers that. If we don't get that federal funding, my state in particular is not allotted a whole hell lot of the funds when it comes to funding these programs out here. They tend to lean very hard on that federal funding. Okay? We are not California. We have the Arch, the Chiefs, and Silver Dollar City as essentially our main reasons people come to tour out here in this particular state, except for those who are budding geologists who want to come see the Missouri fault line. Alright? That federal funding is a lifeline to a whole lot of consumers out here, and things will get dark really goddamn quick if there's any kind of freeze or any significant cutting in regards to federal funding, because those poorer states like Missouri, where the bulk of the population is extremely rural, that is a lifeline. You cut that lifeline, there is not enough, folks. There's simply not enough to cover for the needed services out here. Let me go ahead and continue. Mandatory benefits include services like inpatient and outpatient hospital services, physician services, laboratory x-ray services, and home health services, among others. This also, for some folks, covers things like hospice, direct care staff for those who do have those physical disabilities that need that additional help to be able to bathe, to dress, to get in and out of bed, and be able to feed themselves out in the communities. You see where I'm going with there. It's not cheap. I can tell you that. Optional benefits include services like prescription drugs, case management, physical therapy, and occupational therapy, which means, well, let's just say it's a good thing. A lot of the medications out in Missouri, for reasons that continue to escape me, are ridiculously expensive. I would know. Before I got onto my now private pay insurance that I cover, I had to cover just one bottle of my Paxil medication between getting off my former employer's insurance and going into the single payer that I'm covering at the moment. It was well over $100. Now, that may not sound very much to you, but the folks who are on Medicaid out here and on programs like SSDI or SSI, Supplemental Security Income, they're only allowed to max $600 in the bank account. If their bank account goes any higher than $600, then yeah, they put them in the red, and they have to pay that back with preceding other payments from Social Security. I got boned on more than one occasion just because of it. So, I'm still salty, if you can tell. Okay? They're not cheap out here. People without Medicaid are looking at hundreds of dollars depending on the medication. Okay? And for those of us, whether you're autistic, you're ADHD, or you have some other neurodivergent stuff going on, the mental health drugs cost is, I don't even want to discuss it, just know it is beyond insane. Alright? None of these things are cheap. Case management, which was what I was telling you about regards to the regional offices for the Department of Mental Health that we have out here. There are similar offices throughout all 50 states. As well as physical therapy, occupational therapy, Many people, neurodivergent, get the occupational therapy in particular. And again, remember, it also covers job coaches, job hunting and training, a whole lot of stuff. A whole lot of stuff. Home and community-based services, which we are calling it out here HCBS, are optional services or subject to federal approved waivers. The fact that HCBS are optional or waivered services is why there are often long waiting lists in states in participation in Medicaid-funded community-based supports and services. So, folks, there is a waiting list even after you get approved for Medicaid to get into services through places like ARC or Udivine Center for Autism Services. It's NOVA or Developmental Center of the Ozarks. I have referenced them because those are the ones I'm most familiar with. But from my experience in the other states, it's very much the same thing. You got waiting lists that are essentially coming out of their ears, and it keeps getting larger each year with more and more cuts that are taking place everywhere else. Okay? Also keep that in the back of your mind. Steps must be taken to remove the institutional bias of federal programs, waiting lists must be addressed, and Congress should strengthen a right to a full life in the community. So, what ARC and all the rest of us have been trying to do for years is to actually widen the criteria back to where it was before the 2010s. Because we'll be able to get more people in. If the federal government would, stop with the whole, well, the people who really need it will get it. No, they won't. Because none of these people have ever worked anywhere within the service system, within the mental health field, within the developmental disabilities field. They know nothing about social workers or case management. So when they tell you that sort of thing, please know they don't have the first clue of what they're talking about. And the very worst thing on planet Earth to happen is for them to take control over those of us who are able to get to these vital services and who doesn't. It should scare the living shit out of you. It scares the shit out of me. Alright? The reason why we want those expansions is because the wait lists are so long, especially in the poorer states where, in particular, most of the population is rural and the access to what services are available is already minuscule and very difficult to not just obtain, but to be able to get to those appointments, get those assistive devices. These smaller towns are not very close to big hubs like I live here in Springfield, okay? Yeah, it's already bad. It has been bad for a very long time. This is why so many of us are having kind of mini panic attacks now. I don't necessarily need these types of services anymore. The services I received from back then got me to a place where I don't have to lean so hard on those supports, and the ones that I do need can be covered through my private pay. And let's just put it this way, Burrow's got me. There are others, however, that don't have that luxury. They have a larger need for various services that the only way they can get funded is through Medicaid. So any freeze, any cut, it's dangerous. Now, when you talk about the type of cuts that Trump and Elon are hinting about, the results are going to be disastrous, folks. Absolutely disastrous. All right. Now, I've already got the article up for tomorrow's episode on this little mini series here. But I do think that that's going to be enough, at least for now. So we're going to go ahead and close out here. And I know I never got to the trigger warnings, but it looks like the cussing was minimal, so. But ordinarily, folks, we do not recommend this channel for kids. We do cover dark subjects, and I'm an army brat raised by a truck driver, so I do appreciate your time. As always, folks, we here at Spilling Tea hope you have a good one. I'll be seeing you all tomorrow for the next part of this series. Bye-bye, everyone.